Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, the country records over 18,000 new COVID-19 cases Monday, the highest so far since the start of the pandemic. And amid the easing of restrictions, more Delta variant cases have surfaced, with community transmission now confirmed in Metro Manila and Calabarzon. And later, from lack of hospital beds to the same old problems on contact tracing, how are we faring in terms of our COVID-19 response? OCTA Research Fellow Guido David and former Health Secretary Esperanza Cabral join us live. The country reported 18,332 new COVID-19 cases. That's the highest since the beginning of the pandemic. The new infections brought the nationwide tally to over 1.8 million cases. The DOH says 130,350 or 7% are still active cases. The record-breaking numbers come as the health department detects more Delta variant cases, with community transmission now observed in Metro Manila and Calabarzon. Let's go straight to the source of the story. We have OCTA Research Fellow, Professor Guido David. Professor David, welcome to the source, and thank you for your time.
Of course, as always, Pinky, it's a pleasure to be here.
Record high yesterday, that's at 18,332, but really a number of people are alarmed by this number, but OCTA's projection is actually we will reach even 20,000 by the end of the month or by next week. Can you tell us, is this still your projection or are you adjusting it?
Well, it's still our projection, Pinky. We think that we'll reach 20,000 cases. It could happen this week or by next week. Cases will continue to rise. As we have mentioned before, it will still get worse before it gets better. But we are seeing the light at the end of the tunnel with some indicators. For example, in NCR, we're seeing a slight decrease in the reproduction number. But this is not the case in other regions. For example, in Cagayan, they recorded 1,000 cases for the first time yesterday. So this was a high for them. And also in Tuguegarao, they had more than 300 cases for the first time in that region. So in other places, it's still surging.
Let's break that down. First, you said a bit of good news for NCR. The cases are slowly going down. So from what reproduction number were we seeing to a reduced reproduction number now?
Right, Pinky. So about a week ago, we were seeing a reproduction number of about 1.9. And right now, the reproduction number that we're seeing is 1.64. Cases are not yet decreasing. And people always ask me, well, why is that? Why are you saying that things are improving when cases are still high? We're not saying that cases have already started to decrease. In fact, based on our projections, it will probably happen. It may happen around first or second week of September. But the reproduction number decreasing is in line with the growth rate decreasing. In fact, right now we're averaging 3,965 cases per day in NCR. This is just 13%. So the growth rate has now decreased to just 13%. And that is the first indication that things are improving. We see a decrease in the growth rate and the reproduction number, and then we'll start to see a decrease in cases. But we're not yet seeing a decrease in cases in NCR, just to be clear.
Okay. Can you say that again? We are not seeing a decrease in the number of cases in NCR just yet?
Not yet. We're not yet.
Okay, so hindi pa bumababa.
Sorry?
So hindi pa po bumababa yung mga kaso sa NCR?
Hindi pa. Yung reproduction number or the growth rate, yun yung bumababa. Yeah. So we have to be very clear about that.
Yeah, at least it's good you clarified that, because I was also under the impression that the numbers in NCR are actually going down. They have not yet been going down, but likely to go down because the reproduction number has gone down from 1.9 to 1.64, which at some point it will reflect in the number of cases in NCR.
Yes, exactly, Pinky. And that's why we're projecting the decrease in cases in NCR will happen maybe around the first or second week of September. We cannot promise that because it will depend on the trends and how well we we frame this MECQ, or how well the interventions hold, right?
And in fact, that number of yours, the OCTA numbers of reproduction from 1.9 to 1.64, again, just for the benefit of the public, ang ibig sabihin po ng reproduction number, hindi ba, professors, that kung 1.9, ang isang tao nakakahawa ng almost another person. Kasi yun yung 0.9.
Yes, exactly, Pinky. So yan yung infection rate, or it's related to the infection rate. So bumababa yung hawaan, pero more than one pa rin yung hawaan, it means dumadami pa rin. Pero pag bumaba na less than one yung reproduction number, that's the time na makakita tayo ng downward trend.
Exactly. That's where I wanted to go, because from all our discussions and our interviews, we're always hoping that that reproduction rate is lower than 1. Every time po tumaas yan ng 1, doon na po medyo sinasabi na tataas na ang kaso kasi tumataas itong reproduction rate. So cases in NCR will go down, you're saying, in maybe a week or two. But in the other areas, which we cannot obviously discount, tumataas po yung mga kaso doon. As you mentioned a while ago, Cagayan, Tuguegarao, and even the DOH was saying that it didn't seem, according to Secretary Duque, that the ECQ did not seem to work in, I believe he said, Cagayan de Oro and also Central Visayas.
Well, we look at different aspects of the data, Pinky, so I'm not necessarily disagreeing. Pero what we're seeing in Cebu City, in Central Visayas, is nag-decrease din yung reproduction number. It's now down to about 1.21. It was as high as, I think, 1.7 or 1.8. So it means it's also decreasing yung trend, yung reproduction numbers sa Cebu City. And we are, it's actually clear to us now we're going to see possibly a downward trend sa Cebu City by first week of September. So that's more clear than the NCR. But in other areas, as you mentioned, you're correct. It's actually starting to accelerate or increase in areas like even Pampanga, Bulacan, and of course, Cavite, Laguna, even Batangas and Rizal. So, I mean, not accelerating in some of these areas, but the cases are still high in many of these areas. The reproduction number is still significant.
I have a concern, though, about your numbers, because you said that the reproduction rate in NCR is going down, to which this will reflect sometime in the first week or second week of September. Ano po? Does this mean that kaya po sa inyong data, bumaba tong reproduction rate is because we were under ECQ?
That's correct, Pinky. It's due to the ECQ. Kasi before the ECQ, hindi bumababa yung reproduction number. In fact, tumataas siya ng tumataas when we were still in GCQ.
So does that necessarily mean, Professor, that now that the ECQ has been lifted, that this reproduction number of 1.64, are you looking at this increasing again?
Not necessarily, Pinky, because if we look at history naman, last March to April, we had 3 weeks of ECQ. And then after that, 4 weeks of MECQ. When we moved to MECQ, hindi naman tumaas yung reproduction number. But of course, this will depend on the implementation pa rin. What that means is, we still have to follow the health protocols. Mga kababayan natin, we still have to observe social distancing, wearing face mask, avoiding mass gatherings, social gatherings for now, para mapatuloy ng mapababa yung reproduction number. Kumbaga, we're not out of the woods yet, and the threat is still there. The trends can reverse, Pinky. This is true. So we're not out of the woods. Pero what we're just saying is, based on what happened the past 2 weeks, nagkaroon naman ng effect sa reproduction number, bumaba. We hope na patuloy pa rin bababa yung reproduction number in the coming weeks, even under MECQ.
And that's the hope as well, Professor. But here's another thing that you just made me realize right now. You are comparing the numbers from the April numbers, the surge during April. But in April, Professor, isn't it true na wala pa pong Delta? And then now we are facing Delta that is supposed to be more contagious.
Yes, and that's a very good insight, Pinky. And that's why itong mga numbers na to, itong mga projections na to, these are just estimates. These are just let's say informed guesses. Pero at the end of the day, we still have to see what the numbers will come up to within the next few weeks. There is a factor na may Delta variant, which is highly transmissible. But at the same time, may balancing factor din naman. We have vaccinated, fully vaccinated 30% of the population in the NCR. So these two factors, baka they counterbalance one another. But what we're seeing, yung net effect nila is a gradual reduction in the reproduction number. Hindi siya kasing bilis ng pagbaba nung March to April. At that time, we saw the decrease in reproduction number. Mabilis yung pagbaba niya. Right now, we're not seeing that. It's slowly decreasing, but it's medyo slow.
Professor, when do you see this peaking? And yun muna, kailan ho kaya ito magpipeak? At ano ang estimate ng OCTA on the number of infections?
Well, we're still sticking with our original projection. We may hit 20,000 cases. It's not guaranteed, it's just a projection. 20,000 cases by next week. That may be close to the peak. Even sa NCR, I can't guarantee that's going to be the peak because of the trends in many regions like we mentioned, Cagayan and Calabarzon and Central Luzon. But in the NCR, right now we're averaging about 4,000 cases per day. It's probably not going to go much higher than that. Maybe, we've reached 4,800 already, pero I think we're going to be capped at around 5,000 cases per day. So kumaga, the peak may happen, this coming or next week. Hopefully, we start to go on a downward trend from then sa NCR and also sa Philippines.
Even with the latest report, Professor, that even OCTA was saying, and what has come out, that among the samples tested and genome sequenced, we are looking at a dominant Delta variant among the samples that have been genome sequenced.
Well, that's definitely a concern, Pinky, and it's not just dominant, it's increasing at an I wouldn't say alarming rate, because if we look, or if we compare this with numbers in the UK and in other countries, ganun din yung rate of increase ng Delta variant. Right now, it's about 62%, and it will likely be at around 70% very soon, by next week, based on sampling. So talagang dumadaming Delta variant. That's why we have to remind people to be very, very careful when going outside of their homes. Even vaccinated people, let's exercise caution.
And when we talk about, I just want to clarify that. No, when I meant dominant, Professor, I meant that in the last genome sequence, it was the dominant. It was predominantly, it was the dominant variant. Hindi ho ba? Tama ba yun? That was detected.
Yes, it's really very dominant right now. 62%, more than half of the cases are Delta.
Just one last issue I wanted to discuss with you. How, in terms of active cases, because this is very important to talk about. Right now, we have 130,000 active cases. What number of active cases are you seeing, is OCTA seeing in the Philippines as a whole, number one, and in NCR?
Well, I don't have the number for the Philippines right now, Pinky, but I can tweet that to you. Maybe later I can check that. But in the NCR, we're seeing a maximum of about 60. Or worst case scenario, maybe 70,000 active cases before the end of September. But we're seeing it going down or decreasing before the end of September. So it will likely peak sometime in the middle of September. And this is important because in our projections, we don't see 100,000 active cases right now. This models namin, 100,000 active cases for Metro Manila is a lot kasi during the peak of the surge in Delhi, they reached 100,000 active cases. That's
Really?
Delhi, India. Yeah.
Mhm. But that's the projection of the DOH. I think it's even 130,000 active cases.
Well, Pinky, we use different models, so we have different assumptions. So
Yeah.
yeah.
But right now, their projection is higher than yours.
Yes, that's true.
That's new to me. Or am I mistaken?
Well, to be honest, they haven't been publishing a lot of their projections, so we don't get to see a lot of their projections. So yeah, it's also new to us. I mean, we don't really get to see their projections often. So ayan.
Kasi the only reason I'm bringing it up is because when you come out with projections at times, there are sectors who frown upon your projections because masyadong mataas. Tinatawag nga kayong paminsan, di ba, alarmist. So this is a very different scenario that I'm seeing, or at least I have seen in the past couple of months, wherein you're looking at active cases that are much lower than the projection of the Department of Health. So, Professor Guido David, again, always, maraming salamat po sa inyong oras.
As always, thank you. It's a pleasure, Pinky. Good morning.
Thank you. And coming up, from lockdowns, testing, and challenges in contact tracing, what are we doing right or wrong in the face of a Delta surge? Former Health Secretary Esperanza Cabral tells us more after the break. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our guest today, former Health Secretary Esperanza Cabral. Dr. Cabral, welcome to The Source. And again, thank you for your time. It's good to see you. I will go to my first question already. Did you think, Dr. Cabral, that we were going to get here a record high of 18,332?
Well, I was hoping not. But everything is possible as far as Delta variants and COVID-19 are concerned. So, too bad.
Too bad. The last time, one of the last times we spoke, I was asking you about the situation we were in. And then in terms of government response, I do remember you saying that it's as if we were 10 steps back. Seeing what you're seeing now with the surge, hospitals getting full, how would you describe the situation right now? Are we still 10 steps back, or are we even worse?
I think we're still there at 10 steps back. It's hard to say that we are worse than that. Certainly, the number of cases might say that we are worse than that. But the efforts of the Department of Health and the IATF have been there. We can see it, except that again, it's not yet enough.
What should have we done? Seeing what we've seen in the past year and a half, I mean, is it still going to be a question or concerns on testing, contact tracing, isolation? Do you see any gains?
Well, unfortunately, we sound like a broken record at this point, but it's still the same. We still have not improved in our testing capacity, certainly not in our contact tracing capacity. So we are not able to look for the virus, where it is, and how many people have it adequately. And that, I think, is part of the discussion that you had with Professor David earlier on. Then we also said that we need to look after the health professionals, because if we don't do this, nobody will take care of the people who are sick, not just of COVID, but of non-COVID cases. And look what is happening at the moment. The healthcare professionals are so exhausted, so frustrated, so distressed that they are thinking of disengaging from the healthcare system. We really need to do something about this and fast. And finally, we already said that we have to improve the rest of our healthcare capacity, not just the health professionals, but our ability to provide beds, oxygen, medicines, etc. to people. We still haven't done that. And that's the reason why there are lines in the emergency room. Again, each surge that we have, the same thing happens. What does this say? It says that after the surge, instead of taking the time to improve our health capacity, we relax and hope that nothing else is going to happen. Unfortunately, that is not the way it is. So when the next surge comes, we are caught unprepared again.
Exactly. That's a good point you raised, Dr. Cabral, but exactly what should be done? From one surge, for example. It's okay. We will fix your camera. I'm sure you can still hear me while you're fixing your video. Not to worry, Dr. Cabral. Yung sinasabi niyo po kasi na tuwing may surge, we are actively trying to fix the problem. And then after the surge, you meant it's as if we relax. Please tell us, during a surge where there is a proactive solution, where hopefully there are more hospital beds, hopefully there's more staff, hopefully there's more medicine. Ano ho ba dapat ang ginagawa pag bumaba na yung surge na yan, if the surge is gone?
Pag wala na yung surge, dapat nag-iimbak tayo ng mga kakailanganin natin para sa susunod na surge. Kasi alam naman natin na magkaka-surge ulit. Kaya may Delta variant, kaya wala. That is the natural history of the COVID-19. And we have learned this from other countries, from our own country. This is the third surge, or some say the fourth surge that we have. So we know that even after one surge, there is going to be another.
So when we talk about surge, we talk about surge in cases.
Yes.
You have the DOH very siguro conscious about the word surge kasi nga hindi daw to, it's hard for me to say this, epidemiologic term. It's not an epidemiologic term.
Ako rin hindi ko mapopronounce yun.
And there are, I guess, qualifications for it to be called a surge. So to be very clear about it, they're calling it a surge in cases. Are you seeing some, let's say, light at the end of the tunnel? Number one, let's look at NCR. From last I saw and heard, we are hoping to be able to vaccinate about 50% of the eligible residents in NCR. How big of an impact would that be, considering that now Delta variant is upon us?
That is the light at the end of the tunnel, Pinky, our ability to vaccinate people. Because we know that even if people get sick after they get vaccinated, the illness that they develop is nowhere near as bad as it would have been if they had not been vaccinated. So we keep telling people, please, when your opportunity comes and they say you can get vaccinated, get the vaccine.
Okay. We need to take a very short break. Dr. Cabral, the source will be right back. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our guest today, former Health Secretary Esperanza Cabral. Dr. Cabral, wanted to get your thoughts on this too. When we talk about herd immunity, the standard then was 70%. So the target was really to, or is still, to vaccinate 70% of the eligible population. And then government talked about a population control, which is at 50%. With Delta variant here now, are you still thinking that population control is safe at a 50% percentage and herd immunity safe at a 70% percentage?
Well, even without the Delta variant, I don't really know what they meant by population control or population protection. except that it was their way of telling us that maybe we're not going to reach the 70% that we initially targeted, so we are going to go with just 50%. In fact, because of the Delta variant, which is much more transmissible than the ordinary strain, the original strain that we had, we now have to increase the number of people who need to be vaccinated from 70% to maybe 85% or even higher than that to reach herd immunity. This
Thank you for
number,
correcting me there. It
going
is
to be
population
possible.
protection.
Sorry?
I said thank you for correcting me there. It is population protection at 50%. I was
Yes.
saying population control. So you were saying that dapat hindi na po 70% ang target for herd immunity. It's supposed to be 85%.
Yes, that is what the scientists tell us, that if we are looking at herd immunity from the Delta variant, it has to be much more than 70% and should probably reach 85%.
So it's time to really revise these projections or these estimates, Dr. Cabral.
Yes. I think what is going to happen is, apart from the fact that the variants are coming our way, we are going to need to protect not just adults in the population, but even those of younger age.
What we're really seeing right now, Dr. Cabral, is that when there is a surge in cases, to be able to have the hospitals manage this, we've seen lockdowns. This is our third ECQ or lockdown. And this cannot be the way in the future, as so many people also suffer. Basically, the economy, people are also getting hungry. Where do you see the problem lies? Because you were once the Secretary of the Department of Health. Where is the problem? Is it lack of foresight? Is it the leadership problem? Is it Secretary Duque? Is it probably no cohesiveness in planning?
It's all of the above, Pinky. There is not just one reason. There are very many reasons why we are in the hole that we are in as far as healthcare is concerned in the country. For the longest time, we have underinvested in health. We have thought of health as not a priority, that our priority lies in other things like improving the economy. We did not think that, in fact, the economy is dependent on the health of the people, and therefore health should be a priority.
Very important that you said that, Dr. Cabral. I'd like to thank you for your time, former Health Secretary, Dr. Esperanza Cabral. Take care.
Thank you, Pinky. Thank you.
And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.